Law and Medicine, PACES tutorial, Communication Skills and Ethics, Station 4. The purpose of this presentation is to explain what Station 4 is about. It is helpful for any candidate approaching the exam to have at the back of their mind what this station is supposed to test. Examiners have to agree what they agree on to pass a candidate. Therefore, it is very much worth spending a little time studying the calibration sheet and marking sheet available on the MRCP website. From this, we have drawn up a simple list of tips to follow. The presentation will conclude with an example of a scenario typical of the type that make up the bank of questions. It is hoped that this will give you a flavour of what to expect. The best way to get good at this station is to practice. To conclude, we will offer you practical tips how. Station 4 comes after Station 3 and before Station 5. Here is its precise position in the PACES carousel. In the examination, 5 minutes are allowed for reading the referral letter, 14 minutes for talking to the patient, 1 minute for the candidate to collect his or her thoughts, and 5 minutes discussion with the examiner. Read the scenario carefully before going in. Decide the important issues that you are addressing and what you should stress for the patient to take home. Make sure that you write down the main points you want to discuss, otherwise you may forget once you go inside that room. You are given a blank sheet of paper to scribble on. If possible, use this time to decide which words are likely to constitute medical jargon and think of equivalent words a layperson would understand. When in the room, take a short time to establish rapport and lead or direct the interview without being too controlling. See if the chair has been left a little bit further away from the patient. See if there is a barrier between you and the patient. It may seem obvious, but this point is simply lost on even the most well-prepared candidates. The purpose of this station is simply to test a candidate's ability to communicate with the patient. The language must be appropriate for a member of the general public to understand. Therefore, explanations should be simple but not patronizing. They should be delivered in a friendly yet professional manner. This station is conducted in a highly structured manner. This is so that everyone knows what to expect: the actor, the examiners, and not least the candidate. The marking scheme is also very predictable and must be complied with. As you progress through the station, the candidate should be ideally ticking off in their mind what they have achieved and what they are yet to achieve. The station is supposed to simulate a real-life situation. This could be on a ward or in a busy A&E department, for example. There is a room with the candidate, the patient, who could be real or an actor, the pair of examiners. There is a tendency in this station for candidates to think that they know it all. This is a major error, and experienced examiners will be able to see through this fault quickly and easily. Here are some basic tips for success in this station. You must define the purpose of the interview. This is particularly helpful because if you lost track, the actor can get you back on track. Most of all, you should look fluent and professional. If English is not your first language, the examiners will take this into account and not penalize you at all for this. You should also avoid jargon. Even if you have to use technical terms, you should do your best to define them. Pretend that you're giving an interview on a radio show as guidance. You should try to use open questions. This obviously avoids answers of the yes or no variety. You should listen attentively and check the patient's beliefs, concerns, and expectations. There are in fact various methods advised by experts on how best to do this, and you may have to try this aspect out on a trial and error basis to achieve the right balance for you. You must react to cues. That is, if a patient looks distressed at something you've said, you must not blunder on regardless. Some actors can even cry. Some examiners have even placed a box of tissues on the table. Use your common sense. Towards the end of the consultation, the doctor, that is you, should negotiate and select an appropriate management plan. It may not be clear to you, in fact, what this plan is until the end of the consultation. However, just because this station is designed to examine communication skills, It doesn't absolve you from any responsibility to know your medicine. Empathy is a very important skill of a doctor. You can only empathise if you understand the beliefs, concerns, and expectations of your patient. You should be able to explain difficult concepts accurately and clearly. An ability to do this is considered to be a sign that you understand these concepts yourself. Explaining something badly only instills discomfort and lack of confidence in your patient. You should be comprehensive in approach, but bear in mind the time limits of your consultation. Finally, even if you are short of time, you must find time to summarize the situation and confirm your understanding with the patient. You may have made a mistake in your understanding of the patient's situation, and it is better to rectify the situation before discussion with the examiners. Don't forget that your examiners will have seen everything that you have. You are not supposed to be an expert in medical law or ethics for the purposes of this station. Any background reading you can do on this will help, but is not by any means essential. It is also worth remembering that your examiners are highly likely to have never received any formal training in medical ethics or law. They sat the exam probably when this part of the exam didn't exist. There are certain boxes you have to tick to show that you understand medical ethics, whatever the context. You must respect the patient as a person. You must respect the patient's medical best interests and their wishes, autonomy. You cannot actually do something without a patient's consent if they have mental capacity. Contravening this in law potentially is considered assault or battery. You should use professional judgment. This is particularly useful in face of uncertainty. This uncertainty could be in the diagnosis, treatment, or prognosis. You should show an ability to communicate accurately and honestly. Telling an outright fib in this station will guarantee a fail. You should try to do more good than harm, beneficence and non-maleficence. This can be tricky. For example, should you advise a pregnant mother to have a CTPA on a suspected pulmonary embolism? You should show an awareness of the principles of justice and equity. Justice is maximum benefit for the most number of people. This is, in fairness, the least likely aspect of medical ethics to be examined or to come up in discussion, but officially constitutes the last of the 4 pillars of medical ethics: autonomy, beneficence, non-maleficence, and justice. Here is an example of a scenario. The top of the candidate sheet will always set out who is who. And these are the instructions.
Oh, light switch on.
It might be worth taking a highlighter pen to highlight those key words or phrases which could have some special significance. Either way, you should note that most items of information have been inserted to steer you in the correct direction of the contents of the consultation. The website consists of various scenarios. These contain information for the candidate, the mock patient, and the examiners. There is also a link to the marking scheme. You don't need to go on expensive courses, just get a feel for the station by practicing with friends. It'll be fun.